Well, hello and welcome. I am so excited to talk about today's topic because I know we all work really hard to design great benefit plans. I know I sure do. But if they're too complicated or difficult to understand, our employees won't use them, right? Think of it like this. How many of us read the fine print on all those terms and conditions when we download a new app? Or how many of us actually read an instruction manual cover to cover before diving in? I know I do not, and I'm sure not many do either. Most of us just skim through the details and hope for the best. That's the same thing that happens with our employee benefit plans. We know that our employees communicate in different ways. You may have poured hours into designing the perfect plan. Maybe you're offering tiering like we do. Maybe you have incredible high value providers, we call them here at the Alliance preferred value providers, that will deliver great care at a great price. But if the message gets too complicated, if it's boring, if it's unclear, employees will skim past the details and miss out on the value we're all providing through our benefit plans. So, hello, everybody. I am Melina Cambizzi. I am the Senior Vice President of Business Development and Strategic Marketing here at the Alliance, where we help you self-fund smart. I wanted to take just a second to say Happy New Year. I haven't seen all of you in a hot moment. I believe that last time it was, sometime in the fall last year. So happy, productive, wonderful New Year. And I can't wait to see you, of course, today, other webinars, and then later on in April in person. In today's session, we'll help you break through the noise to communicate benefits in a way employees will actually understand, remember, and use. In this session, you'll learn how to engage with employees across different generations, simplify messaging, and use technology to drive engagement. A couple housekeeping items before we start. I want to remind you of some of the fun things you can do with our updated webinar platform. For those joining us live, you can resize or close all the boxes, as well as control what you see with a menu button at the top. There is also a chat box and an emoji button. If you're finding value in today's content, please give us a thumbs up. We look at them, they come up here on the side of my eyes. Also, give us a heart emoji. I would greatly appreciate it. Please use the chat feature to ask your questions, and we'll answer as many as we can during today's program. A copy of today's presentation slides are available to download from our resources box on your screen and to help you follow along and take notes during this presentation. The recorded video of this event will be made available on the events page of our website on our YouTube channel. We will email a link to all attendees next week when it's available. Let me take a second to thank our sponsors. We appreciate the continuing support of Delta Dental, National Cooperative RX, and MH Imaging. I will also like to welcome a new sponsor to today's program, SmartScan Medical Imaging and Smart Infusion Therapy Services. Both MH Imaging and SmartScan Smart Infusion are high-value providers for the Alliance Network. Again, as I said before, we call them preferred value providers, which means they offer excellent quality service at incredible prices. I have personally used both providers, and my experience is unparalleled to any other imaging center or the hospital imaging services I've ever used. To learn more about how each of these partners can help you help your self-fund plan, click on their links in the resources box on your screen. Now, without further ado, I would like to welcome back to the Alliance webinars a friend of the Alliance, Ms. Lauren Winans from Next Level Benefit. Lauren is an HR professional, a consultant, and an entrepreneur. She looks familiar. It's because she has been with us before. She was with us again last year, about the same time. And we talked about what happens beyond open enrollment and how to keep benefits in focus year-round. So today, she's back with us to help us simplify messaging, to be able to reach all employees within our organizations. If you missed her original presentation, it is available to view on demand on our YouTube channel. We've also provided a link to the presentation in the resources box on your screen. Do check the presentation out. It is packed with great tips, so I highly encourage you to view it. Lauren has been in HR for the HR field over 20 years, and like me, geeks out on benefit design. She loves talking about benefit design. Prior to founding Next Level Benefits, Lauren was a corporate HR leader and benefits director for companies like GNC, Consol Energy, and American Eagle Outfitters. She started her career at Highmark Blue Cross Blue Shield, where she acquired extensive knowledge of the health insurance industry. Her insights have been featured in media outlets such as BBC News, USA Today, US News and World Report, and NBC News, to mention just a few. Lauren, hello, welcome. We're thrilled to have you back to the program.
Thank you so much, Melina. It's great to be with all of you. And what a great intro. Really appreciate that. All right, so we're going to go ahead and get started, guys. So what we're talking about today is really around communicating value within the benefits program. So how do we take these great plans that Melina was mentioning, how do we take what we spend a lot of time developing and creating for employees and really showing employees how to leverage, the benefits that they're being offered. In the context of today's conversation, we are going to focus a bit on steering and tiering. So when we're talking about that, we're talking mainly about, programs that might have a tiered design where some providers provide great value in exchange for valued service, but also in great value from a financial perspective. But everything we're talking about today, despite the fact that there being a lens on the steering and tiering piece, all of the things we're talking about today can be used interchangeably across your benefits program. So there's a lot of great strategies and tips and tricks that we'll be discussing today that you can apply to any area of your benefits program when you're thinking about enhancing your communication. As Melina mentioned, I'm from Next Level Benefits. I started the HR consulting firm about 5 years ago, almost 6 years ago now. And so we're not here to talk about Next Level Benefits, but if you did want to check us out, we got some information here that would be in the slides that you're able to download and follow along with. But what we are here to talk about today is learning practical strategies to really turn the complexity of benefits into more of a clear message to our employees. When employees fully understand benefits and understand the communication that's being provided to them related to their benefits, they're able to feel more empowered to make good decisions and really maximize your plan's value. So we're going to focus on that today in a variety of ways. We're going to mainly focus on these 4 areas here. So we're going to highlight, how clear and engaging benefits communication can drive that engagement, drive that plan utilization, and maximize ROI. We're also going to talk about the difficulties of explaining the complexities that come along with benefits programs. And we're going to talk a little bit about our audience when we're crafting these communications, because that is going to be the key to our success, is creating targeted communication to make sure that we're meeting employees where they're at in terms of the knowledge that they have about the benefits program. Then we're going to walk through an activity that I put myself through. It's called the Rule of 7, and I used the Alliance's benefits materials for their own employees to walk through that activity and come up with some messaging. And so we're going to walk through, what I came up with on that. And then we're going to dive into leveraging technology for engagement, as well as just kind of recapping those practical strategies and tips to help you, to help HR teams, to help owners of small businesses, whomever you may be. We're going to talk through all of those tips to kind of overcome some of these challenges that we experience regularly with communication. So before we kick things off, I just want to kind of, ground all of us in why simplified benefits matter, right? So we know that it's incredibly important to understand, with great clarity, how our benefits are designed and what benefits we have access to. But I think we have to be real with ourselves, right? There's a lot of employees who may not necessarily care. As Melina said, I do geek out on benefits. I could talk about it, for hours, but I'm one of the few, right? There aren't many people out there who love it as much as I do. And I think we need to acknowledge that as practitioners when we are drafting communications for our employees. So simplified benefits, they are going to increase engagement. They are going to improve plan utilization. And it's really going to help with those, missed opportunities. What we do and what we spend our time on and in relation to plan design and really kind of making sure that we're creating a plan that is valuable to our employees, they're not necessarily going to care about the same things that we care about as it relates to that plan design. And so when you think about, why this matters, why should you be spending time, really kind of refining the communication that you put together, whether it be at open enrollment or throughout the year, it's really for these three reasons. And when you crack that code of creating great communication, you really do unleash the power of these three areas. And so what I always recommend, when we're working with clients as it relates to benefits communications, and even just in my own corporate career, I always recommend that you kind of start understanding your workforce, which is ultimately your audience. So you really need to understand that audience in order to create communications that are going to meet people where they're at and be relevant to them at the point in time that they are either in their lives or in their careers. And so it is important to kind of know, who you're talking to. So I would, really recommend, if you haven't gone through this exercise on your own, I would highly recommend that you do it. Think about, who you're talking to from a generational perspective. Am I communicating to, one or two of the generations primarily, or do we have a multi-generational workforce and I need to be thinking about all of the generations within our organization? And what are their preferences? Do they want to see information that is more visual, or do they want to see, just an email with bulleted information that they can engage with whenever they see fit? These are things that are worthy of your time to identify who you have, what are those demographics of your employee population, because that will help to inform the how and the what of the communication strategies that you build. Also, industry considerations are a big piece of this as well. If you are, within an industry that has, multiple different groups within your organization. For example, I worked previously in a retail setting that, we had office employees, we had store locations where employees were working out of stores. We also had distribution centers where employees were working in warehouses across the country. And so it was really important to cater our communication accordingly. So for example, if you, have a manufacturing part of your business, or maybe your business is purely manufacturing, you definitely want to focus your communications, really on those on-site kiosks, maybe face-to-face interactions, putting up material in a break room, or making it available during any sort of stand-up meetings at each shift. Those types of things are going to go a long way. And because you'll know your audience and you're really thinking about how they, what does their time look like throughout the day, and how can you put information in front of them that's going to be relevant and timely. Those types of considerations are really going to inform, how you spend your time crafting that communication, and which pieces of communication and messaging is going to be really impactful. Also, demographic considerations, as I mentioned, this is an area that's really helpful. Knowing where employees are located, understanding their work environment, noticing if there's any language barriers or any additional pieces that need to be translated or drafted into different types of materials for those who might need a little extra support in understanding what the message is about, as well as just, understanding education level and cultural background. These are all things that are going to be really helpful when you think about the types of materials that you're going to be creating. And then lastly here, thinking about tailored communication strategies. So, one of my favorite strategies to use is related to persona-based communications. And it's really just thinking about, okay, okay, I understand my generational considerations. I understand that, this is our industry and we might have some cross sections amongst the organization. And I understand my demographics. So now that I know all those pieces, I can build personas that are going to help me to draft communications of relevance. For example, if we have a large, population, for example, of, millennials, or Gen Z, we're going to think a little bit more strategically about the types of things that matter to them so that we can craft messaging that's relevant to them in that moment. They may not necessarily care about approaching retirement, and planning for their exit from the organization. That's going to be a communication I'm going to cater specifically to a different subset of our population. But they might really be wondering, well, how do I leverage that gym reimbursement benefit that I have? Or where do I go if I don't have a PCP? Who do I contact, and how do I get care when I need it? Those are things that are just going to be natural differences based upon where people are in their lives. And these tailored communication strategies can really help you to break through and meet people where they're at personally and professionally. So now I'm going to walk you through an activity that I did. So I, met with the Alliance a couple of times leading up to our conversation here today. And one of the things we talked about was, wouldn't it be great if we took the Alliance benefits guide, the SBCs, their plan design, had me take a look at it and kind of, identify some areas where we could really magnify the message, and really create some compelling opportunities for employees to kind of hear the things that they need to hear as it relates to not only steering and tiering, but also the value that their plan brings. And so what I did was I was thinking about this in the context of the rule of seven. If you've never heard of the rule of seven, it's a marketing concept. And really, the crux of it is that a potential customer, or in our case, employee, needs to see a message at least 7 times through 7 different channels before they're likely to take action. And I bring that up because it was something that I, incorporated into, one of my corporate gigs at General Nutrition Centers at GNC. What we really tried to do was, say the same thing 7 times in 7 different ways. And it was helpful. It really helped employees to better understand their benefits and feel more confident when it came time once a year to select the plan that was right for them. So I used the same concept when I took a look at the Alliance 2025 Employee Benefits Guide, as well as their plan design materials that they had provided to me. So the first thing I did was I reviewed the information. Second thing I did was I identified the key components and those compelling message themes that I could see within their materials that were related to steering, tiering, and overall value specifically. And then I developed 7 different messages, right? Rule of 7, developed 7 different message examples that could be used in various ways throughout the year to enhance engagement and empower employees with information. So I'm going to share those 7 messages with you so you can get a chance to see what I came up with. But before I move on, I want to encourage you to do this on your own, with your own communications that you might have, whether that be your benefits guide, whether that be some one-page material, whether that be maybe material related to benefits in your onboarding materials. Anything that you have that is related to benefits, I highly recommend you perform this activity. It won't take you long. It's just, really kind of keeping yourself in check and seeing, okay, based on the information and the communications that we have today, what do we want people to know? What's the important message we're trying to drive home? How can I take that message and put it in front of our employees 7 different times, 7 different ways? So my first message that I drafted here was, related, again, all these are going to be related to steering, tiering, and value. So what we're trying to communicate to employees at the Alliance is, and along with many of you on this call today, what we're trying to communicate is that there's freedom of choice in the plans that are offered, but there's also great value in taking a look at the preferred value providers that are within the different networks that we have available through the Alliance. And so it's important that I drive that home. And so that is my big message that you're going to see coming through loud and clear over these next 7 slides. I'm not going to read everything verbatim, but I am going to kind of give you like the high level and the intention behind it. So this first message was really meant to steer people towards finding a provider in their area, particularly one in the preferred value provider network. And so the communication method that I would recommend for this type of message would be, it could be a text message, it could be a break room poster with a QR code, it could be a screensaver with a QR code, where this message can be placed in in one of these areas, and it prompts an employee to go and visit the website where they can find a provider in their area. The next message here is really, trying to hit home that we don't want employees to be, have the misconception that low cost means low value, because that's not what this is. When you tier your benefits program, you're trying to steer people to the right provider at the right time, at the right price point for them. It does not mean that we're trying to get you to go to low value, low cost providers. If anything, really what this design is all about is steering you to high value providers that are providing such a high value at a lower price point, because they're genuinely trying to, increase and enhance the health of their patients. And so, really what this message is about is really focusing on that low cost does not mean low value. And, go out to the website to check out the provider who might be in your area, who can provide you with services if you don't necessarily have a PCP or you're looking for a high value provider at a lower cost. So again, this message could be a break room table tent with a QR code, could be that screensaver with a QR code. This could be a postcard home mailing that goes to the home and ideally is reaching a spouse who might be making a lot of the benefits and healthcare decisions in the home. Message 3, this one is all about, hey, this is mainly from an Alliance perspective, so take that for what you will. Maybe you can kind of make this your own for your own networks and your own doctors that you might have access to. But really, this is about, letting people know, hey, we have a couple of, primary care physicians that are preferred within our network, and we know that they do great work. We've pre-vetted that for you. And if you want to learn more about these preferred value providers, check out the information in your benefits guide. And here are the names of those doctors so that you can reach out to them directly, make an appointment, set up time with them, that sort of thing. This communication method could be an email, it could be a postcard, it could be a handout at a shift meeting. There's lots of different ways that this can be, repurposed and provided to employees. The next message is related to ER and urgent care. And so this is really kind of driving that concept home that not all of your care needs to be taken care of in the emergency room when you need to see someone right away. So for example, if I sprain my ankle, it would be great for me as an employee to know, prior to that happening, having a game plan. If I sprain my ankle, knowing, oh, I don't, the ER isn't my only stop that I need to make. I could potentially consider an urgent care facility. And so, these messages are about educating your employees to understand the difference between urgent care and emergency room, and understand that, with urgent care, they might be able to actually get seen faster in a facility like that. And they will also save money. I would say probably 90% of the plan designs across the country are set up so that, urgent care visits are a cheaper option than going to your emergency room. And this is not based on value of care or the quality of care. This is based on the fact that urgent care facilities, there's more in number of those. They are, designed to kind of handle, a sprained ankle, for example, whereas an emergency room is dealing with really critical situations. And so ultimately, what a lot of plan designs are meant to do is to steer employees to be going to the right site of care for the services that they need. And this message really kind of brings that home. This could be something that is illustrated on a lobby welcome screen at your on-site location, could be a break room poster, could be an email, could be a postcard home mailing. just definitely making sure that employees understand the nuance here is incredibly important, because they're not always going to be leveraging an urgent care or an emergency room, but knowing these things in advance is going to help them make the right decision when the situation presents itself. Message 5, we're really kind of driving home keeping money in your pocket, right? So, really kind of enforcing, enhancing, encouraging employees to take a look at those preferred value network providers, and leveraging them for office visits and outpatient services. Through the Alliance, for their employees that are enrolled in the health plan, they have access to $0 preferred value provider procedures. And so they're able to really maximize their dollar by visiting the preferred value providers for certain types of care. So this is a good first place to go when you have a situation that's come up medically and you need to get some care. And so the call to action here for the employee is to learn more about these services by referring to their benefits guide. And communication method, think intranet homepage. Maybe it's a text message. Maybe it's an all staff meeting announcement, bringing everyone together. And before you're actually there to provide that, maybe a financial update or an organizational goals update, you do a quick blurb, a quick commercial about, how to leverage your benefits plan in this way to keep some money in your pocket. Message 6 is, hey, why is medical insurance so expensive? That's a question employees are always wanting to know the answer to, but it's also an opportunity for you as an employer to share how much of the cost you're actually defraying in terms of premium for your employees. Let's not forget to toot our own horn here, right? So if we are providing a large portion of that premium cost and we're taking care of that for our employees, we want them to understand that, but we also want them to understand the concept of the medical insurance industry and why medical care is so expensive within the US. And, again, this is just a handful of sentences. We could probably, there's novels out there that explain the healthcare industry and why it's so expensive. But just putting together a few sentences helps, people to connect the dots and to understand and, to really make the connection between, my employer is really, doing a lot for me. They're providing, a large percentage of my premium so that I don't have to pay for that, and giving me access to really high value, high quality care. And a communication method like this, it could be something that's included in your benefits guide. It could be something in your open enrollment materials to remind people, what that cost share looks like, how much the employer is actually providing. It could be on your intranet homepage as a quick little, small section off to the side in the margin. It could also, should be part of any sort of total reward statement that you create for your employees. Meaning that's like that total reward statement. I'm thinking, the value of being an employee is not just the base salary that you provide them. It's all these other things that you're providing them. That is the total reward of being an employee at your organization. And lastly, message 7, high deductible versus copay plan. This is a great way to kind of show the differences between the two plans that the Alliance has specifically, but also, thinking of your own plans that you're offering, what is a way that I can help people to understand the differences between the plan options that they have? And, I see these communication methods as being your new hire onboarding materials, definitely your benefits guide, and your open enrollment materials. So before I move to the next slide, I just want to kind of recap. Now, if I'm an employee and these 7 messages were put in various spots for me to kind of, see throughout, either my work day, my work week, my work month, let's say I'm an employee who's coming in, I'm clocking in for the day, I'm in the break room, grabbing some coffee before I start my shift. And if I look up and I see that break room poster reminding me what a high value plan we have, and it also has a QR code reminding me to double check my provider network, to secure a provider or a PCP, while I'm standing there, I might actually do that. I might bring up the QR code, I might bring up the website, I might, text it to my spouse and say, hey, take a look at this. We don't have a PCP yet. We should definitely have one. Then I'm leaving the break room. I'm heading off to my first meeting of the day, which might be a staff meeting. It might be a stand-up meeting at the beginning of a shift. and I'm sitting there and I'm listening to my boss or the person leading the staff meeting, and they're mentioning, don't forget, you guys can keep money in your pocket. Don't forget the differences between urgent care and ER. If you have any questions, consult your benefits guide. Oh, okay. As an employee, I'm thinking, wow, okay, that's right. Last month I did have to go to the ER, but maybe I didn't. Maybe I could have went to urgent care and saved $300. That could have been a good thing. Oh, I'm going to remind myself to look into that. Later during the day, maybe I'm heading out to lunch, and I end up getting a text message on my phone, and it's from my employer. It's a message reminding me, hey, don't forget, to check out our benefits guide and our open enrollment materials. Open enrollment's coming up. You make the right plan decision for you, yada yada. I think you get the point here. The point is, through all of these messages, we're saying the exact same thing. We're explaining the value, we're explaining the high quality, and we're helping employees to direct them to areas where they can learn more about their benefits. And that is what I'm hoping you'll take away from this activity today, is this is an activity that you can conduct on your own with your own materials, to come up with the same, list of messages that you can find different ways to put in front of people, right? So 7 ways, 7 different messages, but ultimately saying the same thing. So really, when I think about, the exercise we just went through, that I went through as I was looking at the Alliance materials, what I would recommend when you are going through those activities is really breaking down the complexity as much as you can. You want to eliminate jargon whenever possible. You really want to focus on the essential details, the main message of what they need to know. Yes, they need to see the full plan design, and yes, they need to understand the nuances and the specific, terms and definitions. But that might be too much too soon, right? So think about the essential details that are important for an employee to understand. And when they need those benefits, or when they have more questions, they'll have access to the more detailed pieces and parts through that benefits guide, through the SBCs, through the various other materials that are available. Also, use visual aids whenever possible. Maybe that's a chart, maybe that's a graphic. Maybe that is even partnering with your provider, your insurance provider, your broker, the Alliance, a variety of different partners to kind of create visual aids that are going to be impactful and powerful, things you can put in front of your employees in a variety of different ways. And then also developing a storytelling approach can be really beneficial. A lot of people, a lot of employees, a lot of just individuals, generally speaking, learn through example. They learn through you stopping, taking a moment to really, explain a concept using those relatable narratives and examples that help them to really see how these things, these concepts can translate to real life examples. That will really help you to kind of crack the code as it relates to your benefits communications. I've seen a lot of communications in my day, and some of them, while they're completely factual and are, accurate and, have all the right pieces to it, it doesn't necessarily break through to the reader of the message and the audience of the message, because it is very straightforward in a lecture style without a lot of examples. So any way that you can create more of a storytelling approach, maybe even creating a fictitious employee, maybe Sally visits the doctor 3 times a year, and Sally does this and Sally does that. Maybe just walking them through examples like that could really help people to relate to the information and the communication and the messaging that you're sharing with them. Also, leveraging checklists and guides, really great idea. If you don't already have a benefits guide, that's definitely something to put together. If you don't have checklists for your onboarding process, that could be a great opportunity to put something together, as well as a checklist for open enrollment. A lot of employees, despite the fact we go through it every single year, don't remember all the things that they're supposed to do and that they're supposed to consider, and the things that they're supposed to remember to ask their spouse or to think about. Sometimes they wait till the last minute, they wait till the last day, and they pick whatever plan is the cheapest, and then that ends up not being the right choice for them. So, leveraging checklists and guides whenever possible, making them widely available to your employee population is incredibly helpful. And then also creating some tailored FAQs, really great strategy. This is something that can be a document that evolves over time, right? So every time you start to get the same question over and over again, maybe it's time to add it to the FAQ and send out a message to everyone re-releasing the FAQs. You can't remind people enough about things that are related to employee benefits. It's just not top of mind for a lot of people, and creating tailored FAQs can really save you and save your time, because you can reference it quite a bit when you get the same questions over and over again. So think about customizing those based upon your employee demographics and the feedback that you receive, as well as the questions that you hear from your employees most often. And, just moving on here to leveraging technology for engagement, there's lots of ways that we can draft and create communication that is going to be incredibly valuable to our employee population. But there's also some ways that we can go about disseminating that information that can be meeting people where they're at and how they like to receive that information. So I highly recommend leveraging technology for engagement. I recognize, though, that a lot of us might not necessarily have access to the same tools and resources, right? Some organizations might be on the front end of technology and have access to a variety of different platforms that can be used for disseminating information, and others might be perhaps not as advanced, but not through no fault of their own. It's just not something that your organization spends a lot of time kind of taking a look at because you're focused in other areas. And so no matter where you're at on that technology spectrum, you really can maximize engagement through technology. That's going to be, whether it's your employee portal, your intranet, push notifications or mobile apps, text messaging, dashboards. There's a variety of different tutorials and walkthroughs that you can create for your employees and just post the link somewhere so that they have access to them. These are all ways that you can find yourself on that spectrum and identify the things that you can do. And then certainly work with partners that are within your existing network right now as it relates to benefits, and find ways to kind of bring those to life. And, I always recommend anytime you're doing any sort of benefits communication, whether it's steering and tiering, whether it's focused on other areas of your benefits program, definitely use analytics to measure how those communications and those methods are performing, and then make changes based on the feedback you get from employees and or based on the data that you see. So, for example, if I post some information about the benefits program on the employee portal, and I have an ability to check to see how many clicks we get per month on that particular item that I have put out there, that's a really great way for me to measure, do people see that it's there? Are people able to access it easily? Is it relevant topics? Are there enough people clicking on it with regularity? If I see that 100 people enter the portal every month, but only 4 people have clicked on my material, it's probably time to switch it out. It's probably time to take a different angle. It might be time to just make it, fresh and clean and concise. It's an opportunity for change. And, please don't forget about asking for feedback from your employees. That is the greatest way, the best way to get information that is usable and something that you can, really transform your communication based on the feedback that you hear from them. So, key strategies for success. So, we talked about this today, but I just want to kind of reiterate, engaging employees across generations, thinking about tailored messaging, targeted messaging. You can say the same thing, 7 ways, 7 different times, but each person's going to receive it and understand it differently. And so it's important to be concise, to simplify that communication, as you see here on number 2, and really focus on clarity and eliminating a lot of the noise and jargon that kind of naturally comes with benefits communications. And then lastly, leveraging technology, using a variety of technology resources that are available to you, regardless of how many, definitely leverage what you have available to you and to your employees. And this is really just going to help to convey the value of your plans. It's going to drive higher employee understanding and utilization. And it's really going to help employees to feel more empowered when it's time to make, healthcare decisions questions, because these things do creep up on us, right? It's not something we think about a lot. We might be thinking about it a lot from a preventative standpoint, but when it comes down to something that we're diagnosed with or a service that we need to have unexpectedly, these are the times where you want employees to feel they're most empowered, to be making the right selections, to feel confident in the choices that they're making, and to fully understand their plan so they're maximizing their benefits when they need it most. So this is one of the last slides I'm going to go over quickly before we head on to some Q&A. So if you have questions and you haven't yet put it in the chat, please do. We're really excited to walk through some of those questions today. But what I would recommend here in terms of immediate next steps, for HR teams, this is catered more towards you, but there's something to be had here even for folks on the call who are not, actively within the HR group. But some immediate next steps here: assess your current benefits communications. So kind of, do what I did today, right? Take a look at your benefits guide, take a look at your plan design materials, take a look at everything that you have forward facing to your employees, and really, nitpick it a little bit, right? Really take a look at it with a critical lens in ways that you can enhance and improve. You definitely don't want to change what's working well, but there are going to be gaps that you can fulfill, that you can create better understanding, that you can improve engagement. And so really take a critical look at what those communications look like. And ultimately identify some of the quick wins. There might be some really easy changes you can make to some of your communications. There might even be a lack of communication. Maybe you don't have that much messaging out there about your benefits program. It could be a really quick win to put a one-pager out there that explains the difference between emergency room and urgent care, and letting people know that it exists, and getting it out there in 7 ways, 7 different methods. That could be a really quick win to help people save money, but also to help the ROI of the plan as well. Also, plan longer term improvements. So, I'm not recommending that you overhaul your communication strategy tomorrow. By no means am I recommending that. But I do think that if you make an intention of developing more of a strategic communication effort, you're going to be able to simplify and personalize benefits communications over time, which is really going to help employees to feel like those messages are catered to them, that they're relevant to them, that those are things that they think about, that matter to them. And so that might mean you have to make some investments over time, whether it be in new communication platforms or just even in your own time, taking the time to revamp that content. But it is going to pay dividends, and it is a process. It's not something you should just throw out there immediately. It's something that takes time. And it also is something that's unique from company to company, employer to employer, based upon your environment and how your employees like to receive information. And lastly, invest in employee-focused tools and training. So anytime there's an opportunity to, not only pool analytics as it relates to the different platforms and feedback mechanisms that you have, but also think about different technologies that might help to create more of an interactive experience, or maybe help to improve communication or improve transparency as it relates to benefits programs. There's lots of different things out there. It's changing, daily. It's actually quite overwhelming, and I totally acknowledge that. But there is a lot out there that can be leveraged in ways that are incredibly powerful for employees. For example, we have a client who recently put in some more pricing transparency, that they partnered with some local health systems. And ultimately what it's leading to is a more educated employee population. It's helping the employees to know where to go for certain types of care. And the technology resource that they have available allows them to input the service that they're looking for and actually see the cost of each of those services at a variety of different locations, so that they can make the best choice based upon what their deductible looks like, or what their copay looks like. And that way they feel a little more empowered that they're not going to go get care and end up with a surprise bill later. So, there's lots of different ways to kind of slice and dice this, but these are some immediate steps that I feel like could be worth your time to kind of dig into and develop a plan around. And then that's me. contact information. If I can be a resource to you in any way, please don't hesitate to reach out. We're going to go through some Q&A here. I would love to hear your questions. If you don't get a chance to ask your question today, but you'd like to reach out to me later, feel free. We're here for you, and you can certainly learn more about Next Level Benefits through these channels, checking out our website, Instagram, LinkedIn, YouTube. We're all over the place. And Melina, I'll hand things over to you so we can maybe tackle some questions here.
Yeah, that is awesome. Thank you, Lauren, for being with us today. So, important topic, especially at the beginning of the year. Yesterday, our CEO, Kurt Kubiak, one of our great account executives, Vicky Faust, and I, your employer's site, we were meeting with them and their consultant, and they're headquartered here in Madison. And we were talking about many of the topics that you touched upon, Lauren. And it was interesting that we're asking us, what is the best way to communicate? And storytelling for us, for the Alliance. First of all, the whole team here, had so much fun with working with you and going through our benefit design and getting into all kind of the different communication styles. But one of the things that we really love is storytelling. And people that know me know that I'm not shy. I share my stories, and I share them very publicly. I can share them with you all too. But I share them very publicly here at the Alliance. And people absolutely react to those. And they ask either public questions or they come to me afterwards and they ask me questions. A couple of us, one of those great folks actually, she is our producer of our event. She's actually sitting right across from me. I can't see her because I'm looking at all of you, but she's sitting right across from me. And we play a game, of how to get to zero. How low can you get when you pay out of pocket for your health insurance? So different things work for different people. And I love it. We will definitely start adding kind of the power of the 7. That was very, very powerful. And to all of you, thank you for sticking around with us at the end of the presentation in this snowy, cold day in Wisconsin. I hope you're comfortable with a hot cocoa or a cup of coffee. I know, however, also how busy you are. So I want to remind you that we have provided a benefits calendar to help you promote different benefits throughout the year. This is the calendar that we shared last year, and it is available for download from our resources box on your screen. So it does look like we have a few questions. I see questions coming through. Thank you to everybody who took time to submit your questions here today, but also in advance of the program. If something has resonated with you, please comment or put your question in the chat box now, and we will answer as many as we can as time permits. So first, Lauren, first question that has come through. How can employees be more proactive with their benefit plan to improve and lower cost? What do you think?
Great question. And, I noticed so employees, right? Not employers.
Employees, yes, employees.
Okay. So great question. And from an employee standpoint, I think for me, when I think about this question, I'm thinking, immediately me and my own personal situations, right? So, I'm married, I have 2 children. One has more medical needs than the other. And when I'm thinking about myself as an employee who's accessing benefits programs, what's important to me is, selfishly, it's what's important to me. And to me, what's important is my son's medical care, because the rest of us don't necessarily leverage, medical care as much as he does. And so what I tend to do as an employee is I look at, okay, how can I maximize the value of my benefits without having a lot coming out of my pocket? I'm concerned about understanding co-payments, and I want to understand if I have a deductible and how it applies. And I'm also curious to understand more about my provider network. And so just putting yourself in the shoes of an employee is a really great way to kind of figure out how you're going to structure communication that's going to be powerful for them, to feel like you're hitting on the points that would be important for them. From an employee standpoint, I think it's about feeling comfortable, understanding your plan design well enough to know how it impacts you personally when you need to get medical care. I think there's a lot of employees who don't necessarily feel confident, and they don't know the dollars, they don't know the numbers, they don't understand the plan design, they don't know where to go to find the right in-network doctor. And it's not for lack of trying. You guys are putting great information out there, but sometimes they might need a little bit extra to help them get what they need. It might be that rule of 7. It might be, they like to receive information via email versus a poster, or vice versa. And so I think, from an employee standpoint, it's the employee's job to understand what's relevant to them and what's important to them when they're using their benefits program. It's an employer's job to provide as much information in concise and easily digestible pieces and ways, in order for the employee to learn and educate themselves over time. And so that's kind of both of our roles in this whole process, but employees definitely, they definitely need help in understanding how to leverage their plan, and that's what we're here for.
And so you did ask me, is it employees or is it employers? How about if we turn the question for employers now as well?
Yeah, no, absolutely. I think, from an employer standpoint, what you're really needing to focus on is, how can I make sure that I'm giving our employees the capability and the ability to maximize their understanding of the plan, so that when they need to use it, they feel comfortable, they feel confident, they know who to go to, they know what questions to ask. And that's a hard thing. That isn't something that gets learned in one doctor's visits or in one communication material that gets sent out. And so really, communication as it relates to benefits is a journey. And that's why I highly recommend, from an employer standpoint, you think more about strategy as it relates to communications, as opposed to check the box, I got to have a communication for this and a communication for that. Think of the strategy of it. How can I bring employees along and help educate them on a topic that's really complex, but has financial implications for both of us, right? For both the company and for the employee.
Yeah, thank you so much. We also got a question of, you talked about technology platforms. So Mika is asking, do you have any recommendation for technology platforms, particularly for companies that don't really utilize or take advantage of technology platforms? Before I ask you to answer, Kim Bauer from Ultra Credit Union. Hi, Kim. Thank you for being with us. She says that her consultant prepares it for them. So the role of the consultant is very, very important here, right? But she can't recommend Canva highly enough. Do you have any recommendations, Lauren?
Yeah, well, so Canva is one of my faves. That's a good one. Canva is also a place where you can create a lot of like graphic design, making things real pretty. And there's a free option, so it's not even a paid thing. So you can actually go out there and maybe pretty up something that you've already been putting out there, but just by refreshing it a little bit, it looks brand new to an employee and maybe attracts some attention, right? So Canva is a great one from a technology standpoint of how to like zhuzh up the communications. But there's also some other platforms out there as well. The name's escaping me, but maybe as I describe it, it'll come to mind. But there's a couple of platforms out there where you can actually create an app that allows you to push information out to your employees. Jotform is one that I know of, that you can create apps through Jotform. And it's pretty simple. And, I think if there is a cost associated, it's pretty minimal. I'm thinking probably under $200 a year at most. So, if you wanted to create a place where an employee can download an app and have their benefits guide and their SBCs and that tailored FAQ document, if you wanted to have all of that material just in one spot, and when they're sitting in the urgent care facility at 10 o'clock at night, they know where to go if they need, to find out what benefits they have available to them, or when to push back on the provider who might be trying to charge them at the site of care. So there's a lot of There's a lot of platforms like that. Jotform's the one that just comes to mind, quickly. And then also too, I mean, you're probably definitely leveraging some other, software that, I highly recommend if you have any existing vendor partners, existing technology partners, by all means, reach out to them, understand, what additional capabilities might be available that you're not aware of, that maybe your company's not taking advantage of. And also, there's a lot of integrations out there, right? So, like, for example, if let's say you're an organization that leverages Microsoft, or maybe you leverage Google Workspace, there's lots of integrations where different technology software and platforms can integrate with your existing materials to help amplify or maybe adjust the way that certain things look. For example, I added an integration with one of our clients. We helped them add this integration where whenever a employee goes out to their intranet, they receive a pop-up, and depending upon where they're located, they receive a different message, because geographically speaking, with this client, it matters, where they're located and what messaging they see as it relates to benefits. So there might be something very easy right off the shelf with one of your existing partners that could really be a powerful way to enhance communication without spending a lot of money and without it taking a lot of your time.
Yeah, and I'm just going to name names because, most people that are listening to me, they know me. So Kim's consultant is truly amazing. It is Garrett Jaroof with the Insurance Center. Fantastic. He prepares all that for her and all of his clients. There are other amazing consultants that we have. Yesterday, we were with Cottingham and Butler and Joey Bacchus, and they provide both the app and also the technology to send questions to question employees and to get feedback from employees. M3 here locally also has a lot of tools. So definitely leverage your consultants, your TPAs. Come and ask questions at the Alliance. We will absolutely give you our thoughts and help guide you. We got a question from Stephanie. And she says, steering and tiering strategies are typically perceived as having a negative impact for employees, right? It's that idea, what you were talking about before, Lauren, where, low cost means low value or low quality, which we know it is not true. Here's Stephanie's question. How do you communicate the positive of these strategies for both the employee and the employer without really getting bogged down in the details, the technical jargon, or the negativity? And then she uses something that Stephanie, I want to use. How does smart brevity on these topics look like? I love
Yeah.
that question. So I wanted, most likely this is going to be our last question for the day, Lauren.
Yeah. So, Stephanie, fantastic question. And what a way to ask it, too. I love that. The thing that I think we're still trying to overcome in this space is, some employees feel really compelled to use providers that they're comfortable with or that they know through a family member or referred to them. And sometimes they're not in network. Sometimes they're more costly than they need to be. And so there is a barrier in understanding out there for employees and just consumers in general of really understanding the nuances of, okay, because I have identified that this provider charges that much less for an office visit or that much less for an outpatient service, that does not mean that you're not getting a high quality service. And so I think when you're thinking about ways to communicate that concisely and quickly and easily without all the jargon, I think what it really comes down to is showcasing that provider's rating. Maybe it's a rating. Maybe it's a score of sorts. Maybe it's giving insight into some of the great survey responses and or feedback that this provider has received, and then also kind of moving into this provider. Not only are they incredibly high quality, they receive 5-star ratings, and they have a variety of different comments and great positivity around the services that they offer. But it just so happens that with our plan, they are, it's the lowest copay that you're going to pay for this office visit, or it's going to be, very reasonably priced outpatient service. So I think it's about the storytelling when it comes to, this concept is, if you have employees who have taken advantage of seeing some of these, high quality providers at a lower price point, let's spotlight that. Maybe that employee is willing to share some of their stories. Maybe they're much like Melina, who's willing to share, some personal stories that will help people to understand how they can leverage this part of their network. It's definitely, there isn't an easy solve for it, but there is definitely an opportunity to help through storytelling, help people to understand that low cost is not low value. In fact, 9 times out of 10, it is high quality in exchange for low cost.
That is wonderful, Lauren. And everybody, this wraps up today's event. I want to thank our speaker, Lauren Winans, for joining us today. Lauren, it's a pleasure. Are we meeting again next year, same time? I don't know. I'm not making promises because my marketing team will tell me that I'm making promises that maybe I cannot keep. But I love, love, love spending time with you, Lauren.
Oh, thank you. I'll come back anytime you guys want me to join.
And
I'd be
so,
happy to. Always love partnering with you
thank
and meeting with all of your attendees as well.
Thank you. And your attention to detail, looking at our own benefit design, helping out and giving the tips that you gave today. That was awesome. Every year, we have an incredible time with you. If you would like additional support or any of the content we discussed today, please reach out to your account executive here at the Alliance. We have experience in benefit plan design. We're happy to assist you. We are such close collaborators with many of your consultants. If you're not a member of the Alliance and you're interested in learning more, feel free to reach us out. Our business development team using the QR code or URL on your screen. If you would like a copy of any of the handouts that are not able to download them, or you have not been able to download them during this live session, please send an email to events@the-alliance.org. We're happy to email you a copy. If you're watching this webinar live, and you can claim your CE credit by clicking on the View Certificate button on your screen. If you don't see the button, click and drag the box on your screen to make it bigger. Finally, we would love to see you in person. Yes, our in-person events are coming up. Check out our events page and stop by and say hello if you're attending any of the upcoming events listed there. Be sure to register for the next month's webinar and join us in person at our annual Spring Symposium on April 23rd here in Madison at the Monona Terrace. I would, and we would love to see you there. So thank you again. A privilege spending your time with us. Our privilege. Thank you for joining us. Remember, when you think of the Alliance, think of self-funding smart. Take care, and I will see you soon.